Hello, my name is Patrick McConville and this is Dr. Ashley Hambright. We're obstetrical anesthesiologists here at UT Medical Center. We'd like to take some time today to discuss the background of an anesthesiologist as well as the services we provide here on labor and delivery. We'll follow that up with discussing the different types of pain relief that are options during labor and delivery. We'll go through risks, benefits, and alternatives, and then show you a simulation video so that you know what to expect during placement of that epidural. We'll also finish that up with discussing the progress on labor as well as the impact on C-section rate.
An anesthesiologist is someone who has completed a 4-year college degree, a medical degree, which is also 4 years, and an anesthesia residency, which is also 4 years. They then have the option to complete a fellowship in different areas of anesthesia, including obstetrics. This is usually a 1 to 2 year duration.
The Department of Anesthesiology provides 24/7 in-house coverage for our laboring patients. We care for both the healthy patients desiring a great birthing experience as well as those with chronic medical conditions that require our care. Whether or not you desire an epidural, someone from our department will come talk with you to obtain your medical history in the event of an emergency. At that point, they'll also discuss your options for pain relief during labor.
There are several different pain relief options that will be available for you during your labor and delivery course. These can include natural remedies such as controlled breathing, meditation, and relaxation techniques, IV medications, nitrous oxide administration, and epidurals. IV medications are typically given early in the labor course or to those who have a contraindication to epidural placement. While limited, they do provide up to 30% of pain relief during labor. Nitrous oxide also has limited effectiveness, but can provide some relaxation during your labor course. This is managed by our obstetric colleagues. If a C-section is required during your stay, the preferred technique is either an epidural or a spinal. This allows for the mother to remain awake during the delivery process, as well as the support person to be present. It also provides superior pain relief over other pain modalities. But the most important thing is it's the safest technique for mother and baby during a C-section.
Epidurals and spinals are not without risk. Fortunately, serious complications are very rare. Bleeding, infection, and nerve damage are serious but are extremely rare in healthy patients. Headache is the most common complication of an epidural, and it occurs about 1% of the time. There are effective treatment options for that. Back pain, while very common after labor and delivery, is usually due to causes other than an epidural. The most common symptom from an epidural is some tissue soreness in the lower back that lasts a couple of days.
Hi, my name is Dr. Carrie Poland. I'm one of the obstetric anesthesiologists at the University of Tennessee Medical Center. We're now going to demonstrate for you the placement of an epidural. We will first position you sitting up on the side of the bed with your chin to your chest, your shoulders relaxed, and the bottom of your back curled out as if you had bad posture. A family member or loved one is welcome to stay with you during the placement of the epidural. We will ask them to sit in front of you and be your support person during the epidural placement. We will next wash your back off with a cleaning solution and place a plastic drape over your back. We ask you to please not reach around to touch your back after it has been cleaned. After we place the drape, we will numb your skin with a small amount of numbing agent. This part can feel like a bee sting and will only last for a couple of seconds. From this point, you should feel only pressure in your back as we perform the procedure. We ask you to stay as still as possible, but please let us know if you feel any sharp pain, and we will give you more numbing medication as needed. When we have placed the epidural needle in the correct position, we will thread a tiny tubing or catheter into your epidural space. This small, flexible tubing will stay in your back and all of the needles will be removed. We will then inject a medication called a test dose through this catheter to ensure that the catheter has entered the correct spot. We will tell you as we are about to inject the medication and ensure that you are not having a contraction during this time. As we inject the medication, we will ask you to tell us if you have any symptoms, such as ringing in your ears, a metallic taste in your mouth, or if your legs start to feel very heavy very quickly. After injecting this medication, we will tape the catheter in place. The catheter will be taped to your back and will lay flush with your skin. It is safe to lie on your back and move from side to side during the remainder of your labor. Your catheter will be attached to a pump, which will continuously inject numbing medication. You will also have a button that you can press to give yourself extra doses of the numbing medicine if you should need it.
Common questions that patients have are, when can I have an epidural and what's the impact on labor? You can have an epidural at any time that you and your obstetrician agree that you are in labor and progressing towards delivery. The impact on labor can be variable. For some, it will slow labor. For others, it will progress more rapidly. Overall, epidurals slow labor on the average of 30 to 45 minutes during your labor course.
We hope this information has been beneficial.
And you have a happy experience on our labor and delivery floor.